men toe touch-ups. Find out how far women are willing to go to fit into their favorite designer stilettos. Coming up on GMA Health, Cinderella procedure? Find out what some women are doing to jam their feet into sexy, strappy high heels. Welcome back to GMA Health. I'm Stephanie Tsai. It's no surprise women love their high heels, but what may be surprising is the lengths that some are willing to go to fit into those shoes as far as cosmetic surgery. So foot surgeon and podiatrist Dr. Krista Archer is here to give us the facts on these elective foot fixes and whether you really need them. Dr. Archer, welcome.
Thank you.
So first of all, is this really a new debate? Are women getting more plastic surgery for their feet?
You know what? It's all semantics, really. I mean, foot surgery has been around for hundreds of years, and you know, we're correcting bunions since 1881. The first bunion procedure was described, and women always loved high heel shoes. We didn't need Sex and the City or Carrie Bradshaw to tell us that high heels are fabulous. I mean, you could wear high heels no matter what size you are. If you're up 10 pounds, you can still fit into your gorgeous high heels. So it's just a matter of what we're calling it now. And some doctors have chosen to call it cosmetic foot surgery, but I would like to say it's corrective, and it's a combination of form and function. So there's a diagnosable deformity, usually called a bunion or a hammer toe, and we fix it with the foot surgery.
So in your mind, there really is no difference between cosmetic foot surgery and foot surgery needed for some sort of deformity.
Right, it's just, again, semantics, what we're calling it.
Yeah, and there's a clinic in Beverly Hills that calls it the Cinderella.
Yeah, the Cinderella procedure, foot narrowing. Foot narrowing really is correcting bunions, a bunion on one side and the other side, where the fifth toe is and where the first toe is. And by correcting the bunions, you're making the foot narrower. So you're correcting the form. It looks not so nice, but it also affects the function of the foot. And by doing the surgery, we're helping people walk better and align the joints so they function properly.
I've always been curious whether high heels and tight shoes cause bunions, or whether that's a genetic thing.
It's absolutely genetic. There have been studies on barefoot tribes in Africa, and they have bunions. So the shoe aggravates the bunion, the pre-existing condition, but it does not cause the bunion.
So what type of person should consider foot narrowing surgery?
Well, bunion surgery, we'll call it, is someone who has a little bump on their foot. There's degrees of bunions. There's a mild bunion, moderate, and severe. When your bunion is hurting you every single day and it's preventing you from wearing the shoes you want to wear, then it's time to consider surgery.
And how long is the recovery time, I'm curious, for a surgery like that?
Bone surgery, for bone to heal, 6 to 8 weeks. But now with newer techniques in bunion surgery, patients are walking after a week.
Okay. Now moving on to another procedure, toe lengthening, toe shortening. I didn't know that you could do that.
I know. It's all the way we're wording things. And the bottom line, it's hammer toe surgery. Again, been around forever.
And what is hammer toe?
Hammer toe is when you have imbalance of the tendons and the toe actually pops up a little bit and is curved. So toe straightening, we're straightening it, correcting the hammer toe. Toe shortening is when the toe is a little bit long and it's caused, in a shoe, it's popping up. Again, hammer toe correction. Toe lengthening, there's two things, but one is correcting bad hammer toe surgery. The toe is too short. We're fixing it.
So again, that's not necessarily really about the aesthetics of one's foot, although correcting it might make you have a more beautiful foot.
It's form and function again. So it's functioning improperly and it happens to look bad. You correct the function and you're correcting the form as well. And now we do techniques coming from plastic surgery where we put the incision on the side of the foot rather on the top of the foot to make it look better as an end result.
So that's some of the progress that's been made in this field, is that you can get bunion surgery and you can get hammer toe surgery without the big scar.
Right.
And that's an aesthetic thing as well.
Right.
We look at some of these shoes here. If you have bunion surgery, you have hammer toe, is it then not advisable to get back into this kind of shoe? Like, can you get it back? Can you get the bunions back?
Well, when I have a woman coming to me and she says, I've had a little bump on my foot, I've noticed it, I have a closet full of gorgeous shoes, but I can't fit into them anymore. That's because the bunion is a progressive deformity. It gets worse over time. So by correcting the bunion, she can get back into the shoe she has in her closet. but we're not doing the bunion surgery just because she wants to wear a Cinderella ballet slipper, you know?
Gotcha. There's one procedure I'm very curious about, which is the injections into the ball of the foot.
Right.
What is that surgery about?
Okay, that's an injection. It's not really a surgery. And we use a dermal filler called Sculptra, and we put it into the bottom of the foot, and it induces collagen formation. So someone with, again, a diagnosable deformity, it's called metatarsalgia, where the bones on the bottom of the feet on the ball of the foot are prominent, and with every step you're stepping on bone. There's no more fat there, no more padding left in the foot.
Ouch. Is it true that some women are actually injecting Botox, which we think of more as a wrinkle filler, into their feet?
Botox is also used for underarm injections to prevent hyperhidrosis.
Right, sweating, excessive
sweating. Same thing in the foot. Some people have a real problem with excessive sweating in the feet, in their palms. So those are the people who choose the Botox injections.
Okay, so the bottom line is, if somebody's considering any of these procedures, what would you advise their checklist be before they make that decision?
Look, the bottom line is you want your feet to feel good. If your feet hurt, your whole body hurts. So you want to assess, do you have a deformity diagnosed by a doctor that can be fixed and improve your function of your foot, and also make your foot look better?
Well, thanks for all those foot
You're
facts.
welcome.
Podiatrist Dr. Krista Archer. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now. We'll be right back.